Well, good afternoon and welcome to Healthy Lifestyle. I'm Lori Anne Casdia. Our goal here at Healthy Lifestyle is to inspire, educate, and empower you to fulfill a healthy, emotional, spiritual, and physical life so you can feel empowered to live the life you have always wanted and dreamed. I am Lori Anne of Healthy Lifestyle with Lori Anne. I am your host today, and I'm excited to say that it is a Northwell Health Day. We love this, love on our show to have our friends from Northwell Health on. Today we have Dr. Frank Ocasio. He's a board certified anesthesiologist, say that 3 times fast, and pain management physician. He received his medical training at Weill Cornell Medical College and Memorial Sloan Kettering Cancer Center, the Hospital for Special Surgery, and the Icahn School of Medicine at Mount Sinai. He serves as the Director of Acute Pain Management, as well as serving as the Chair of Pain Management and the Enhanced Recovery After Surgery Committees, which we'll talk more about, at Huntington Hospital, one among my favorite hospitals because I was a candy striper there. Dr. Ocasio worked closely with Northwell's top surgeons to deliver an opioid sparing approach to pre- and post-operative strategies to reduce pain and speed recovery from surgery, which is outstanding. So in addition, he is the director of the North Shore Headache and Spine in Huntington. And Dr. Ocasio's passion for healthcare actually began in holistic medicine. We'll talk more about that as well. He's able to combine his philosophy with cutting-edge interventions to treat headaches, neck pain, back pain, and joint pain to restore function and provide the highest quality of pain management to Long Island. Welcome to the show, Dr. Frank.
Hi, how are you doing?
I am wonderful. How are you doing today?
Very good, very good. Thanks for having me.
Oh, gosh, it's so great to have you on the show. I love this topic. I have previous experience with a family member with opioid abuse. And so when I hear someone does something like this, I'm really excited. How did you transfer from being in holistic health? As I understand it, you were a massage therapist. Am I right?
Yes, I was a massage therapist. Yeah, I think it was about over 20 years ago.
Oh, my gosh. And how did you transition to becoming a pain management physician?
Well, the transition was initially massage brought me into the field of healthcare, and I then realized that as much as I was able to do as a massage therapist, there was more that I wanted to bring to the table. So from there, I decided to go into medical school because I was a massage therapist around the age of 19. And then I went off and studied to go to pre-med and then eventually medical school. My passions led me to anesthesiology, where I focused on opioid-sparing modalities to speed people through their surgeries. And then I branched out to deal with chronic pain in the outpatient setting.
So what are some of the, I'm just going to jump right in here too. So what are some of the pain management options outside narcotic medications? I am not a fan of narcotics. Matter of fact, whenever I have anything done, I flipped out I had an operation back in 2013 and my physician was flipping out because I wouldn't take anything but Tylenol and Motrin. And he's like, no, you're going to be in a lot of pain. You need pain meds. And I was like, well, as long as it's not in the opioid family, because I'm not taking that. And I'm allergic to morphine, so I can't take that. So they didn't have a lot of options, and there's another one that I can't take. So what are some of the options that allow us to handle pain?
It's a couple different approaches. When you're looking at medications that aren't opioids, let's say that you wanted to take Tylenol, ibuprofen. All of those will work to help to reduce pain, and they're non-opioids, so it doesn't lead to any addiction or dependence, although they do have their side effect profiles. When I'm looking at how to manage pain in someone who doesn't want to take opioids, it kind of depends on the source of the pain. If you have someone who, let's say they just had a knee replacement or are going for a knee replacement, there are actually a lot of options available. If in those kinds of scenarios, you can actually target the nerves, which give sensation to the knee area, and essentially deactivate them for a period of time so that they're able to get through their surgery without needing opioids, or at least significantly reducing the need for opioids. You can also target those nerves in a way where you provide a temporary nerve treatment in such a way that I don't know if you've ever heard of TENS, where you do a little stimulation externally. You can do that for 60 days to get someone through a rough patch, or even afterwards, if they have pain, reprogram the nerves so that they no longer experience pain in the same way.
And how do you go about doing that?
So when it comes to targeting nerves, you can do it via ultrasound guidance, where I use an ultrasound to visualize the structures themselves and then guide a needle down to the nerve. The other option is what I wanted to say is once I get down to the nerve, you can do things like a nerve block. You can do what's called a radiofrequency ablation, where you heat the nerve to deactivate it. You can also alternatively freeze the nerve to deactivate it, and both of those have their pros and cons to those. The other option is to also use an ultrasound and get down to the nerve and provide a temporary wire attached to a small battery, which allows you to stimulate the nerve and block those incoming pain signals. And part of the problem with chronic pain is that when you see pain repeatedly over a long period of time, it starts to change your neurological structure so that your body, even when the pain is removed, continues to see pain. And so blocking these incoming signals and providing the appropriate signal can actually lead to significant pain relief.
Oh my goodness! And does this connect over to the ERAS, the Enhanced Recovery After Surgery Committees? You're a chair of, right?
Yeah, no, absolutely. The goal is to come up with medications that you would give as a standard medication, sort of a standing medication around the clock. So we have patients who are coming in and they'll get things like Tylenol around the clock every 6 hours. They'll get something like Celebrex or some sort of anti-inflammatory around the clock. And all of those are medications which will help to reduce pain so that if you do eventually need to provide an opioid, it's less than you would if you were not giving those medications. In addition to that, you can do nerve blocks to target extremities. Let's say you're having surgery on an arm or a leg, then you're able to numb that particular region so that, again, you have less pain and don't have the need for opioids.
So what do you think of the nerve stimulation to help the chronic pain management? What's your feeling on that?
I think it's come a long way. It's in the last probably 4 or 5 years, we're at the point where we can reprogram the nervous system in such a way where ideally, even after temporarily stimulating the nervous system, you can have long-lasting relief. There's this device called the Sprint PNS, for example, where in post-amputee patients, you place the device, it's there for 60 days, you take it out, and these patients have had chronic pain for over a decade, now have a reduction in pain from, say, an 8 down to a 3 or a 4, where nothing was able to provide that kind of relief. Even the newest innovations in spinal cord stimulation, such as Medtronic, they're looking at trying to augment the signals that come into the spinal cord, and they have data showing that the way the spinal cord looks after stimulation is that it actually returns to more of a natural state, a non-inflamed state, so that it doesn't look like a chronic pain state.
So, and I totally understand that. So, pain is there to remind our bodies that, we got a problem here and it's protecting our bodies. So where's that level between making sure that there's that you do isolate that particular area, and don't cause more damage, hence the pain that reminds us, I can't move that way because this is inflamed. And pain is caused primarily because the body protects that area and it puts extra cushion and water around it, right? So how do you balance the between the two so that people don't, someone like me, if I don't feel pain, I just go. And that could be detrimental. I could actually cause more damage by doing that. So how do you come up with the techniques, and how do you know what technique is best for what patient? How do you marry that together? To me, it sounds incredibly complicated.
So when I look at a patient who has pain, there's certain characteristics. So chronic pain or at least neuropathic pain is pain that derived from sort of a malfunction of firing of the nerves, has certain characteristics: burning, tingling, shooting. These are the kinds of things which make me think that, okay, this is an abnormal pain sensation. This is one that's getting in the way of normal functioning. If you have someone who just happened to injure their elbow acutely, they were playing, playing with their grandkids or, doing some weekend warrior project and injured themselves. Those are the kinds of scenarios where pain is actually a sign that healing needs to occur and you need to take a break. So it depends on the nature of the pain.
Okay.
I just have to take a real thorough history and decide, is it worth removing pain from this particular person, or is this pain helping them? Typically, if the pain has lasted longer than 6 months, it's considered chronic pain, and at that point, they would benefit from some reduction in their overall pain to improve quality of life.
Yeah, because I see sometimes when you have pain, let's say in your foot, suddenly you're walking different, so now you're hurting your knees. So it's something that they really have to assess, right? So one of the questions I have for you is, who should come and see you as a pain management specialist? Who are your best clients?
I would say anybody who has had, let's start with the easy one. Anybody who's had pain in a particular region that's lasted greater than 6 months, they already meet the definition of someone with chronic pain. And at that point, it warrants having a more careful investigation as to whether or not is this pain that will go away. It depends. You have to do an investigation to determine, is this pain that is greater than 6 months at this point, then you know that it's chronic pain. And I think we could do different modalities to improve that. If it's someone who's going for surgery and they're a little bit hesitant to take opioids, which I think most of us are nowadays, and you're curious as to what are the options before surgery or potentially after surgery to help to mitigate some of the pain and therefore the need for opioids, I think that's a good time to have a conversation. Anybody who's had pain that feels like that neuropathic pain that I described, that burning, shooting electrical pain, those are great candidates because at that point you've already had a change in your nervous system from chronic pain exposure. So at that point, it's a great time to actually see a pain specialist.
So are there any over-the-counter or natural things that people can do for their pain management other than the Tylenol, Motrin type cocktail? I
would say the most efficacious over-the-counter sort of holistic approach.
Hold on, I'm looking that word up. Hold on. No, I'm kidding.
I would say so. The best alternatives if you don't want to take Tylenol, you don't want to take ibuprofen or anything that's of that type of medication, and you are looking for an all holistic approach. The options are a little bit limited, but that doesn't mean that they're not helpful and available. When it comes to pain management, when it comes to medications you could use, I would say capsaicin, the hot chili pepper.
Oh, sure.
Those are actually pretty effective. And, there's some over-the-counter patches, such as the Salon Pause, that have that in there. And that will actually, you apply it twice a day. And over a few days, up to a week, you start to notice a decrease in pain. And that actually works by when you have the hot pepper on your skin, it causes a release in those little molecules which create that burning pain called substance P. So it depletes those transmitters such that you actually aren't able to have the same amount of pain response.
See, here I thought all along that your eyes are so burning from the hot pepper that you're distracting yourself from the pain. So that's how it works. So no, I'm just joking. So just to take you off that for a second, are you seeing any new treatments for pain on the horizon that might work better than some of these other meds and or would work in concert with holistic? I know a lot of people are really trying to move more holistically than actually taking narcotics.
I think the good thing about the holistic movement, just as an aside, is that we're at the point where now at least the data is starting to, they're trying to produce the data to support what kinds of medications or what kinds of holistic options can you use and at what doses, because that's from a physician standpoint, you want to know that. You want to know what's the amount of medication, what's the frequency that I'm giving it, what's the side effect profile, how long is it going to last, and all of these things. Because, if I'm going to give advice to someone and say, take turmeric, for example, as an anti-inflammatory, I want to know what's the dose. Should it just be turmeric or should it be the curcumin? Because the curcumin is a more active component. How much of that should they take? So all these are important questions, and I think all of them are appropriate for patients to take, or at least a trial. They should at least let their surgeon or primary physician know that they're taking them, because let's say someone's coming in for surgery and they're taking ginkgo for memory, and then they want garlic for cardiovascular health. So those also make you clot a little bit less. So if you're coming in for surgery, you have the potential of bleeding. So those are the kinds of things that are beneficial on one side, but they also have a risk profile. So you just have to be careful and make sure your physician's aware that you're taking them. I think that as far as medications or holistic options that are on the horizon, the way that I look at it is I want to get someone who's in pain, has reduced quality of life and limited activities of daily living, and restore them to as best the best version of themselves that I possibly can. And in order to do that, I have to look at how do I do that without providing opioid medications, or even medications which I'm targeting one particular area, but they have systemic effects.
Right.
So
right.
What I was talking about before, even though it's considered an interventional approach where you're placing a needle to get to a place, in my mind and sort of from my background, it is somewhat holistic, because I'm not actually needing a medication to do that. I'm able to bring your body as close to a native state as possible.
Yeah, I love the fact that you combine both, Western medicine and Eastern medicine. I love that approach. And when people come to you, that kind of guidance is fantastic, because it gives them options. How about, do you work with, is there benefit for cancer patients for pain management? Because I know some people going through cancer are just in horrific pain. Do you work with patients like that?
Oh, absolutely. No, I work with cancer patients, and I think that cancer patients are a very challenging demographic, type of patient, because often when you have a tumor or something that's growing, it can grow and affect things in different ways. You might have one that's affecting one nerve now growing and affecting more than one nerve, and so the question is, how do you address those issues? And so there's definitely options available for those kinds of patients, and it's often, unfortunately, the patients who have cancer will come later in the game, as opposed to coming earlier on, where you might have been able to actually help them earlier in the progression of their disease. You'll see someone sort of in the later stages, but their quality of life could have been significantly improved coming much earlier.
Oh, that's really good to know. And you work a good amount with Huntington Hospital's U.S. News and World Report top rank orthopedic department. So with that, is there anything, and having dealt with some orthopedic surgeons, is there anything going on for orthopedic surgery about pain medicine? Like, is that pain management combined with the orthopedic surgeon?
No, absolutely. I think we tend to work hand in hand.
Yeah.
I will often get phone calls ahead of surgery, after surgery, and either with a patient in the recovery room or post-operatively on the floor, or as they're recovering from their surgery. The goal is to have a plan in place before a patient comes in for a procedure. Patients are all different, and they all come with different medical issues. And so I want to know, are they taking opioids beforehand? Are they not taking opioids? Do they have a history of anxiety and depression, which could potentially lead to something called catastrophizing, meaning that if you have pain, your experience of the pain is greater than maybe someone who didn't have those conditions. So those are the people who you would want to be better prepared for, so that as they come for a knee replacement, a hip replacement, or some sort of orthopedic surgery, you're able to get them through it much easier, instead of sort of playing catch up at the tail end of the thing. I'm not really sure why she's so uncomfortable. We've tried the standard cocktail. Well, the standard cocktail doesn't really work for this patient. Right.
So it would be good to get some management prior to actually having surgery, so you know what to expect and you know what profile you're looking at.
Right. Exactly.
Yeah. Last few moments. What would you tell our viewers? Best thoughts.
I would say that pain management is actually not just for people who have been suffering for many, many years and feel like they can't get out of the chair anymore. It's for anybody who has realized that their hip's bothering them a little bit more than it normally does. Or, I'd love to go and play soccer with my grandkids, but my knee's just acting up. Those are you should come in much earlier and get yourself tuned up so that we can get you back on track much more quickly.
Oh my gosh, Doc, I am so appreciative of you coming on. Hope to have you on again. Thank you so much for giving us such great information. In the meantime, you are listening to Healthy Lifestyle with Lori Anne, and we're going to take a quick break. Welcome back to Healthy Lifestyle with Lori Anne. I am Lori Anne. If you have any questions, comments, or ideas you'd like to hear more about, please contact me at healthylifestylewithla@gmail.com. I know you all have been reaching out, and I love it. We love having those conversations. And follow us on social media at Healthy Lifestyle with LA. Also, if you want to follow us, we are live streaming on Facebook while we do these recordings. So feel free to jump on Healthy Lifestyle with LA on Facebook, and you will see us live. In the meantime, we are coming back after that great interview with Dr. Frank, and we are going to revisit one of our good healthy lifestyle friends, Sunil Sood, Dr. Sunil Sood, who is board certified as a pediatric doctor and also pediatric infectious disease. And he's the chairman of Pediatrics Infectious Disease for Southside Hospital. Welcome back to the show, Dr. Sood.
Thank you, Lori Anne.
It's really good to have you. I hope the day's treating you well.
Yes, it is.
That's good.
Not today.
Yes, it is. So let's jump right into it. And with the holidays coming up, we have Halloween coming up, and young adults coming back from college. How should we handle this? How should the families handle this? Actually, I was just having this conversation with my guy. And we were talking about how we're going to handle Thanksgiving because his mom is 81 and we want to keep her safe. And we have some students coming back from college and we just want to make sure that she's safe. We're all safe. We're all doing the right thing. We actually put a protocol in for Thanksgiving where we're taking their temperatures coming in and we're making sure that if anybody doesn't feel well, they stay home and they can Zoom into our Thanksgiving. We'll even drop off Thanksgiving dinner to them. But so they could join us, but they don't have to come into the house. And we're also setting up tables all around the house, separated more than 6 feet away so that we can do that. And also everybody has to wear their masks unless they're actually sitting at the table and eating. So we're actually being more restrictive than some of the restaurants, but it's going to protect mom,
Yeah, I like that protocol. It's a good infection prevention protocol that one would want to use to try to prevent spread of all respiratory viruses. So this time of the year is what I say. We're entering the respiratory virus season.
Yeah.
It's an annual ritual. It's not an annual transition. And so, obviously we're aware of COVID, but there's many different respiratory viruses that affect children that do typically get spread to other family members around Thanksgiving time or even, through the winter season. So go ahead.
So I was, I used to say that my kids were petri dishes because ever since they went to school, they would bring all this stuff back. They would be sick for like 5 minutes and then I would be sick for a week and a half. And I just never understood that. And now in this atmosphere, what are some tips for a healthy holiday season?
Right. So I think, the first thing is, let's just hope that the temperatures stay at least in this range. Well, last year they did through November, because to the extent we can use the outdoors as much as possible, even if it's partly outdoors, the patio, we bought ourselves an very effective outdoor heater that can radiate heat for about, 400 square feet. But if that's not possible, and it does actually turn cold during Thanksgiving, you really need to have planned ahead. That is, planned now for how many people are actually going to be in your home, right, indoors during the gathering, right? So really, you're going to limit the number of family members this year, and maybe split, your Thanksgiving celebrations across several families, like you were saying, and some people may have to remote in I completely agree with masking up. With my family, no matter how careful we all are, and many of us have been tested and are negative, we still all just mask up when we're sitting at home, and try to separate rooms and bathrooms to the extent possible if anybody has even a sniffle, because it's very difficult to know what virus one has, and some of these respiratory viruses, including the coronavirus, do not necessarily give you fever. So fever, checking someone's temperature is a very good practice, but it's more if they have any kind of symptom, they're a little more likely or much more likely to actually spread any virus, not just the coronavirus.
Now, do you think our kids coming back from college should be COVID tested? Do you recommend that?
So some of them, as you know, are actually getting periodic COVID testing already at college.
Yeah, that's true.
Some of these are these very somewhat unreliable, lower sensitivity rapid antigen tests. And so the benefit of that is it's rapid and they can keep repeating that maybe 2 a week. But that's not 100%. Definitely gold standard is the swab that goes into the back of the nose, and it's a PCR test. So just testing them when they come home is actually not that helpful, I think. And again, it wouldn't change my home protocol.
Right.
I think that masking, distancing to the extent possible, like you said, eating in separate rooms to the extent possible. And I see wherever I go, wherever store I go, there's shelves and shelves of hand sanitizer now. So now's the time to stock up on hand sanitizer.
True, but you're at the home. Just wash your hands with soap and water, right?
Yeah, but again, there is a hazard in washing soap and water unless you're careful then to clean the handle and the faucet and the handle of the flush toilet. We have to always be aware of that as well. I think people are much more careful when they use the bathroom, but let's say you're outside in a family room or in a kitchen and you touch something, you actually don't realize you touched something because, and then you touch your nose and then you touch something that someone else touches. So it's a good idea to constantly be sanitizing your hands in addition to washing your hands as frequently as possible. So stock up on sanitizer, stock up on tissues. And in general, again, young kids behave much better than older kids. I'm just amazed at my 2-year-old granddaughter. They put a mask, her parents put a mask on saying, going to the park with grandpa and grandma, but it's a rule. She wears the mask, and she does not take the mask off. And, even some of the other kids I've seen at the park, they will keep their mask on whether they're on the slide or off the slide. And it's actually fairly practical to have even younger kids follow these precautions.
Yeah, children are very, very compliant when it comes to stuff like that.
That's right.
Yeah, I've seen that. It's so funny. I've seen people walking in a mall and the children have their masks on and mom and dad don't. And I think that's just hysterical. It's like do as I say, not as I do. But so now on a different topic, you're the chair of pediatrics at a newly renamed South Shore University Hospital. What should people know about that pediatric care you're able to provide there? And I'm so excited about this.
Yes, thank you. So actually, what people should know is we really are a unit of the Cohen Children's Hospital. So it's like Cohen Children's Hospital expertise as a branch at South Shore University Hospital. We can take care of both in the emergency room and in the pediatrics unit most common conditions that children may occasionally need to be admitted to the hospital for. If they need intensive care, obviously, then they will be transferred from the emergency room to the children's hospital. But that is, fortunately, the minority of conditions that children get sick with, even with these multiple respiratory viruses. So the other thing, of course, is excellent newborn care for new moms delivering babies. And South Shore is really stepping up and building now a women and infants hospital, will be a higher level of neonatal care,
Yay.
So-called level 3 care in the next year or two. So
outstanding.
Provide, tertiary level ICU care for small babies, high-risk deliveries, and at the same time, we also have outpatient offices where Cohen Children's specialists including myself in infectious disease, can see outpatient problems in about 10 different pediatric subspecialties located in Bayshore and in Smithtown.
That's outstanding. My brother is a neonatologist, so when you said that, I was just like, yes, finally up here. We finally have one. Yeah, he has a whole center down in Louisiana. He had put that together over 10 years ago. Actually, it's going on 15, I think. So I can't even imagine. What has it been like for you to watch the South Shore University Hospital transform into this tertiary hospital? And it's actually, I think, isn't it considered a major medical center in Suffolk County?
Correct. I think Northwell's aim is to basically make it a tertiary care hospital destination so that anybody needing high-level care, both especially in adult specialties such as cardiology and neurology, to not to have to travel to North Shore University Hospital or Long Island Jewish Hospital. So it's been very, very gratifying. This is now my 10th year here, and we started from what that time was a small community hospital. And pediatrics was, almost disappearing at that point, and kind of revived it and gradually have recruited more doctors and have, built a beautiful pediatric unit and really made ourselves part of Cohen Children's Hospital in a very robust way, where all the expertise from there is available to us at South Shore Hospital. So it's been very gratifying, like I said, to be able to provide safe and high-quality care to families in the area. And keep in mind that we actually have a sizable under-resourced population that may not necessarily have easy transportation to go all the way to New Hyde Park, to the Children's Hospital, or, for that matter, to Stony Brook Hospital. And if they can get that basic, excellent pediatric care at South Shore, then we're doing a great service to the community, especially the immigrant community in the area.
Yeah, that's amazing. I mean, and there are several Cohen Children's Medical Center pediatric specialists, right, in Suffolk County. So right. Why is it so important, do you think? And I'm always trying to figure this out. I mean, I think I know why, but why is it important to have specialists and that kind of care readily available in our backyards?
Correct. Well, one reason is parking.
Okay,
it is
fair.
So much. That's what parents always comment. It's so much easier to find a nice outpatient facility, without the congestion of going to, which is almost in Queens, right, the New Hyde Park centers, and large spacious offices with very clean and safe facilities. And some of the specialty problems are, require multiple or regular follow-up visits. For example, children with gastrointestinal conditions such as inflammatory bowel disease, or children with heart problems, or children with seizures. They may need to be seen, every month sometimes, or even more frequently. And to be able to just drive up to something that's within a few miles of where you live and get that care, I think is a real boon. So it's good that the specialists come out to the community rather than community members having to travel all the way to see.
Yeah, because it has to be stressful. I mean, I know I don't like being away from my kids, and when they were small, it was just like, oh no. And then, taking that trip is into the city with the kids, and they're already not feeling well. It's really highly stressful, not only for the children, but for us as parents. So I would see that that's a huge benefit to be right here in Suffolk County. So here's a question for you too. The last time we spoke, you were talking about acute, and you might have to correct me on this. I think it was flaccid myelitis. Thank you, myelitis. Correct. Thank you. I was like, oh my God.
We could just say paralysis, acute flaccid paralysis.
Yeah. So what is that again, and what should parents know about that? I know we just touched it and we had to run.
Correct. So it's known in short as AFM or AFP.
Yes.
And actually, just Google CDC AFP and it comes up. And it's a condition that seems to peak every 2 years. And it is something that occurs after the summer, so in the fall and early winter time, where a child, usually a young child, typically between, say, 4 and 10 years of age, will suddenly develop weakness of one or more limbs. Often it's an arm, often accompanied by neck pain or back pain. and suddenly find themselves, you find that the child is weak. And we call it paralysis because sometimes it can actually be a long-term or permanent paralysis. So it is really a polio-like condition. We don't see polio anymore, but we do see this condition that seems to follow some of the summer viruses that children may otherwise not get that sick with. So as we speak, we're actually dealing with a case right now, and this is something that the CDC has on its radar. There have been cases, about 40 suspected cases in the country since the summer, and the key here is to immediately seek an emergency room that is competent in dealing with children, such as at South Shore Hospital, and have that evaluated. It may turn out to be nothing. It may turn out to be an injury and just arm weakness or leg weakness from an injury, but it actually may be this more serious condition that requires hospitalization and treatment.
Does that get confused with sometimes having Lyme disease? Because sometimes when you get bit by a tick, you get that weakness in the arm too. It comes with the pain too.
Right. That is, but actually that I would say is not the most common symptom with Lyme disease.
Okay.
And the Lyme disease, it tends to be more of a gradual process. And usually you get neck stiffness and you will actually present to the hospital with headache and symptoms of spinal meningitis.
Okay.
In this case, there may not actually be much fever, and all you have is this very dramatic onset of weakness or even paralysis of one limb.
Wow.
So something to be aware of. We're part of an NIH protocol on this, so we are the right people to come to because we're very aware, and we've made all our emergency room doctors very aware to look out for this condition.
So everyone, and someone just asked this question to me, everyone wants to know, as an infectious disease specialist, what are you keeping your eye on for 2021?
Right. In 2021, unfortunately, there will be more COVID. I see no end to this right now. I hate to sound like a pessimist, so we really have to be prepared to deal with this. And I think we're dealing with it better in terms of, just mentally and physically, in terms of continuing our distancing and practice and masking practices. I'm curious to see how well our educational systems can handle the inevitable disruptions. Those disruptions have only just begun. But I have a feeling that our systems, schools and colleges, will actually develop more resiliency and will be able to, test and isolate and close down when necessary, but that educational life will go on. I think I'm optimistic about that. I know that pediatricians in the healthcare system have adapted remarkably well to this ongoing pandemic, and, care for other conditions is starting to really become back to normal levels.
That's good to hear.
I think there will be advances in office testing. I think we will have better in-office testing so that every time a test is done, it doesn't have to be sent out and you wait 4 days for the results. I don't think that we can expect vaccines for children, so the COVID vaccine for children, anytime until late 2021, because first we have to look at the experience in adults. There are about 6 good vaccines in the pipeline. By the middle of next year, I think we will have a very good uptake and usage of those vaccines, and then only will they start to look at pediatric vaccine use. But it will happen. I think it'll happen in 2021.
Oh, good. Okay. So as a recap, tips for the healthy holiday season, specifically Halloween. Any advice for safe trick-or-treating?
Yes, Halloween's coming up this Saturday, and I would say don't cancel Halloween, although it will be quieter. Some families may be reluctant to have their kids go trick-or-treating. I think I've heard of small groups, community and school groups arranging small events, almost like in a bubble. Like I said, small kids do behave. They will probably put their mask on and be careful. I plan to have pre-prepared goodie bags out on my doorstep, and if they don't want to, me to open the door and say boo or trick or treat, I won't do that. But they can pick up their goodie bag, pre-packaged, so there's no, so it's like a contactless transfer.
Yeah. Yeah. Or you can take your kids to the local shopping center and they can pick out which bag of candy they want right there. It makes it a lot easier. Take some of the fun out of it, but it makes it a lot easier.
Right.
But
at least you get your candy.
Exactly. So that I really appreciate that. That's really good advice, and thank you for giving us more advice for the holiday season that's coming up. We need to really take care of our children and take care of ourselves so we can get through this and get back to our normal. So thank you so much for being on again. It's always a pleasure. Glad everything is working out, and thank you for all you've done, especially during the pandemic, Dr. Sood. You're just always there for us. So thank you so much.
Thanks for inviting me, and please continue your good work.
Oh, thank you so much. And thank you all for joining us today on Healthy Lifestyle with Lori Anne. My heart is so lifted by sharing this time with you. Time is limited, and your time with us is your gift to us. So I really appreciate you for joining us. In the meantime, I'd like to thank our guests today, and of course, our wonderful, fantastic, outstanding producer, Michael. And we are here to serve one another, as we always say here. Take a moment, step out of your day, and do a little something for someone else. In the meantime, thank you for joining us on Healthy Lifestyle. I'm Lori Anne Casdia. Until next time, play a higher role, serve a higher purpose, show up for you, and show up big.